Critical thinking questions. 1. A student who is angry at her professor for a low grade begins yelling at the roommate for no reason. The nurse recognizes this behavior as which defense mechanism? A. Projection. B. Displacement. C. Rationalization. D. Regression. 2. Match the defense mechanism to the appropriate example. 1. Sublimation. 2. Rationalization. 3. Regression. 4. Denial. A patient refuses to believe their cancer diagnosis. 4. A teenager starts sucking their thumb after parents divorced. 3. A person joins a boxing gym to cope with anger. 2. A student blames to poor exam score on the unfair test instead of studying. 1. 3. A nurse is assessing a client who just received a new diagnosis of diabetes. The client states, "This can't be right. I feel perfectly fine." Which of the following is the most appropriate nursing response? A. You should talk to your doctor again. B. Sometimes people go through denial before accepting a diagnosis. C. You shouldn't feel that way. This is a serious issue. D. You will get used to it eventually. 4. A nurse is caring for a client undergoing chemotherapy. The client's lab results reveal a low white blood cell, WBCs, count. Which of the following actions is the most appropriate to include in the client's plan of care? A. Encourage intake of fresh fruits and vegetables. B. Limit visitors to immediate family only. C. Place the client in protective isolation. D. Provide a high-protein diet to promote wound healing. 5. A nurse is educating a group of nursing students about methods to break the chain of infection. Which of the following actions best represent interrupting the mode of transmission? A. Wearing gloves when handling bodily fluids. B. Disinfecting surgical instruments before use. C. Placing a mask on a coughing patient. D. Ensuring only clean items go into a patient's mouth. 6. A nurse is assessing a client with diabetes mellitus, DM. Which of the following best explains why this client is at increased risk for infection? A. Elevated blood glucose increases immune cell production. B. Chronic illness decreases the need for immune system activity. C. Chronic illness disrupts the body's natural defense mechanism. D. Insulin therapy suppresses the inflammatory response. 7. A client receiving long-term corticoid steroid therapy asks why they are more prone to infections. What is the nurse's best response? A. Steroid increase your blood pressure, which affects healing. B. Corticosteroids destroy white blood cells responsible for fighting infection. C. Steroids decrease your inflammatory response, which helps defend against infection. 8. A nurse is teaching a group of nursing students about the body's defense mechanisms. Which of the following best describes the third line of defense? A. The release of histamine and serotonin at the site of injury. B. The engulfing of pathogens by phagocytes in tissue. C. The immune response triggered by recognition of foreign substances. D. The flushing of pathogens from the urinary tract by urine. 9. A patient exposed to Mycobacterium tuberculosis, TB, does not develop active TB disease. The nurse understands that this is likely due to which of the following immune response? A. Phagocytosis by neutrophils. B. Third line of defense forming granulomas around the bacteria. C. Lysosomal destruction by gastric secretions. 10. A client's WBC count is elevated. The nurse knows this condition, termed leukocytosis, most likely indicates A. A parasitic infection. B. A decreased immune response. C. The body's response to bacterial infection. D. A suppressed bone marrow response. 11. A client is admitted with suspected tuberculosis, TB. Which of the following isolation precautions should the nurse implement? A. Private room with surgical mask used by the nurse. B. Private room with negative air pressure and N95 respirator use. C. Room with HEPA filter and contact precautions. D. Private room and use of gown and gloves only. 12. The nurse is caring for a client diagnosed with influenza. Which of the following are appropriate infection control measure? Select all that apply. A. Wearing a surgical mask within 3 feet of the client. B. Wearing a gown and gloves at all times. C. Placing the client in a private room. D. Using an N95 respirator when entering the room. E. Performing hand hygiene before and after patient contact. 13. Match the type of precaution to the appropriate condition.
1. Airborne.
2. Droplet. 3. Contact. MRSA wound infection 3. Measles 1. Mumps 2. 14. A nurse is educating a student nurse regarding pulses. The nurse knows the student nurse is correct when she states, select all that apply. A. A1 plus is considered normal. B. Feeble pulse means that the pulse is weak and irregular. C. 3 plus is considered normal. D. An absent pulse means no pulse. 15. The nurse understands that an NA, nursing assistant. A. Takes care of patients because the NA is certified to do. B. Takes care of patients because the NA was trained to do. C. Takes care of patients because the NA has a diploma to do. D. The NA just takes care of patients. 16. The nurse understands that critical thinking is important in nursing because A. It engages the brain out of habit without much conscious thought. B. It is purposeful and outcome-oriented. C. A problem-solving method and more. D. The mind is made up and no additional facts will be considered. 17. The LVN understands that within the scope of practice of the LVN can A. Collect patient data. B. Complete the initial patient assessment. C. Formulate patient nursing diagnosis. D. Works independently all the time in practice. 18. The student nurse is learning about the different nursing methods. The student nurse knows that the functional method is A. Based on the belief that goals can be achieved through group action. B. Task-oriented where the tasks are divided among staff. C. Staff composed of only nurses. D. Supervise and coordinate management. 19. A nurse is caring for a client with difficulty breathing and elevated heart rate. The nurse organizes the symptoms and prioritizes care to give oxygen first. Which cognitive level is the nurse using? A. Knowledge. B. Comprehension. C. Application. D. Analysis. 20. A nurse is developing a care plan and focuses on identifying the underlying issue to create a step-by-step solution. This is an example of A. Random thinking. B. Habitual thinking. C. Problem-oriented thinking. D. All or none thinking. 21. A nursing student demonstrates directed thinking when they A. Allow their mind to wander while completing routine tasks. B. Purposefully analyze a patient's symptoms to create a care plan. C. Mentally replay a mistake over and over without moving forward. D. Avoid considering other solutions once a conclusion is made. 22. Which of the following is a characteristic of problem-oriented thinking in nursing practice? A. Repeating a situation mentally without action. B. Solving a specific issue by developing a logical plan. C. Making assumptions without all the facts. D. Thinking based only on previous habits. 23. A nurse is reviewing a patient's medication list and deliberately evaluates each drug for potential interactions based on patient's symptoms. Which type of thinking is being used? A. Habitual thinking. B. Directed thinking. C. Rumination. D. Random thought. 24. Which role is an appropriate role for the LVN to take while working in the hospital? Select all that apply. A. Chief Nursing Officer, C now. B. Teacher. C. Researcher. D. Supervisor. 25. The LVN meets the love of her life while at the hospital, and they decide to get married and move to another state. The LVN knows that to check what she is able to do in another state as a nurse, she will have to A. Check the National Council of State Board of Nursing, NCSBN. B. Check the State Nurse Practice Act. C. Check the Cadet Nurse Corps. D. Check the American Nurses Association, ANA. 26. The nurse is caring for a client for her attending a rehabilitation unit after suffering an MI. The nurse knows that this is. Select all that apply. A. Disease prevention. B. Secondary prevention. C. Tertiary prevention. D. Health restoration. 27. The nurse is reviewing Healthy People 2030. The nurse understands that which objective focuses on the environment affecting the population's health functioning and quality of life. A. Health behaviors. B. Social determinants of health. C. Settings and systems. D. Populations. 28. Florence Nightingale contributed to all of the following except A. Improved sanitary conditions during the Crimean War. B. Her efforts laid the foundation for modern nursing practices. C. Built a lodging house in Crimea. D. Developed a call bell system. 29. Because of World War II, nurses. Select all that apply. A. Created a nursing shortage at home due to the demand of nurses in the Army and Navy. B. Training programs with minimal training were created for nurses. C. Cadet Nurse Corps was founded. D. The role of the nurse increased. 30. The nurse is evaluating steps in the nursing process. Which of the following steps describe implementations? A. Comparing actual outcomes of nursing care with expected outcomes. B. Systematic gathering and reviewing of information about the client. C. The providing of required nursing care to accomplish established client goal. D. Development of nursing diagnosis. 31. The nurse caring for a C. diff patient notes a foul-smelling odor coming from the patient's brief during peri-care. The nurse recognized that this is A/N. A. Objective sign. B. Subjective sign. C. Normal finding. D. Abnormal finding. 32. Which of the following nursing diagnosis should the LVN prioritize to report to the RN? A. Impaired physical mobility. B. Impaired sleep. C. Impaired verbal communication. D. Ineffective airway clearance. 33. Which of the following is the most appropriate nursing intervention for a client with a nursing diagnosis of altered nutrition, eating less than the body needs? A. Client will sit in a Fowler's position during meals. B. Client will be assisted with meals at 0, 800, 1000, and 1500 and will be seated in a high Fowler's position. C. Client will be encouraged to self-feed. D. Client will demonstrate willingness to cooperate. Thank you for watching.